27, assisting with physical examinations. Now, of course, the reason we do physical examinations, sometimes it is because your patient is sick, but sometimes it is just to promote health, promote wellness with your patients. You know, a lot of times they are kind of preventative type screenings and things that are going to be done for your patient. So sometimes it may be to determine fitness for work. If you have, if you work in doctor's offices or other places, so I know we are geared towards teaching about long-term care in this class, but there are other jobs out there, okay? And again, then sometimes we're just trying to diagnose. You have a patient who is sick or something is wrong with them, and you're going to help assist your doctor or nurse practitioner, whatever, with actually doing this physical examination. Now, in nursing centers, we do want our patients to have a yearly examination, at least, just a yearly physical. I still get yearly physicals, just have blood work done and things like that, besides the womanly crap we have to do. But just in general, you know, blood work and things, just to kind of check the overall health, Now, basically what you are going to do when you're helping with this examination kind of depends on where you work. It depends on their rules and their regulations. Sometimes it's going to depend on what state you work in. And then of course, it also depends on who you're working with and what their preferences are. The preference of your practitioner, your doctor, whoever. So some of the things that you might need to know, some of the terminology you're going to know is a laryngeal mirror. Laryngeal mirrors are little things they stick in your mouth so they can look at maybe your teeth, maybe your gums, your tongues, things like that. Kind of look at your throat maybe. Those are called laryngeal mirrors, okay? Then you have nasal speculums, so they can look inside the nose. Most of the time, you don't see that in generalized medicine. I've only seen it used mostly in ear, nose, and throat doctors, but that doesn't mean they can. I see it more often there. Now, ophthalmoscope, you'll see that most of the time at your eye doctors more than anybody, but again, I'm not saying that your doctors can't use it. I'm just telling you areas that it's used the most. Now, ophthalmoscope is the light they shine and kind of has like a magnifying glass they can look through and look at your eyes for see any changes, any problems in your eyes. Some of the other things are otoscopes. We use those quite a bit to look inside the ear, especially in children. We have all the ear infections and things going on. They're going to look sometimes to look inside the eardrum, or what's we call in medical terminology is called the tympanic membrane. We want to look and see the health of it. We can tell if you have an ear infection or not, sometimes depending on any drainage in there or the color of it. A percussion hammer, those are to test your reflexes. Just tap, most of the time you're going to see them tap on your knee. I always think about the cartoons, they barely touch the knee and then that wham, kind of judo kick, the patient kind of judo kicks the doctor after that, you know, just to be funny. So those are actually called percussion hammers. Then we have tuning forks. Tuning forks are used, it's like you hit it against something to make it go ding, and then they test your hearing with that. And then you have the vaginal speculum, which fortunately, John, you never have to deal with. Again, that looks like the clear plastic duck bill that they put in there to open up the vaginal area to be able to get like tissue samples and stuff so they can test you for different types of cancer, okay? Now, whenever someone is getting a physical exam, and especially depending on what kind of exam they're getting, we need to be very aware of how our patients feel, how nervous they might be, and kind of just be aware of your patient and their needs and their concerns, because basically you are preparing them physically and mentally for this exam. So under OBRA, that we have talked about, they have certain rights. They need to, it's okay for them to know who's going to do the examination, what doctor or practitioner are they going to see. Why is it being done? What are we looking for? And then again, what to expect. You really want to prepare your patients well before the doctor starts in doing stuff, because unfortunately doctors sometimes aren't that good at doing that, but sometimes they kind of expect you to tell the patient what's going on. So again, this resident does have a right to personal choice. If there are changes in that exam they want done, or maybe there's certain things they do want done, and maybe they don't want this done, that's okay. They have that right. Okay, they have the right to personal choice. And also, a lot of times you have to have consent. It may not necessarily be written consent, even though sometimes it is, but you at least at a minimum have to have verbal consent to do an exam on a patient. Now, informed consent, again, in order to get informed consent, you've got to tell them what's going on. Okay, we've already discussed that they have that right. So again, we need to tell them about the exam, why we're doing it, who's going to do it, when it's going to be done, and kind of describe the procedure. Okay, if you're fixing to give somebody a shot, don't tell them, oh, this won't hurt a bit, and then jab them and give them some sort of medicine that like kills them. Okay, you really need to describe, okay, well, this is going to pinch, this is going to sting, this is going to be cold, this is going to be whatever. You know, the more information you give your patient, the better. Now, again, privacy is a huge, huge thing. Just like with every single skill pretty much that we do, the first thing you do, you kind of have that little section of things you do when you first go in the room, like identify yourself, identify the patient, things like that. And one of the very first things we always do is provide for privacy. Okay? So it's going to be shutting the door, pulling the curtain, whatever that means in whatever particular room and situation you're in. So as soon as my update, all right. See if I can fix this. Now, all right. So again, we're going to either close the door, close the screen. A lot of times they're going to wear a hospital gown that just provides easier access for what we're trying to do. Maybe they're covered with a drape. The ones we use now are usually disposable and are thrown away. And then again, the only part that we are examining is going to be exposed, and most of the time we're going to wait until examination time before we expose that area. Okay? Now, before the exam, you want to make sure that your patient empties their bladder. And again, because the examiner may need to push on their belly to be able to feel for like any hernias or any kind of problems that are going on. You know, you can even tell sometimes about like kidney problems and liver problems sometimes by pushing on someone's stomach. So again, that would be very embarrassing if you push on in the right place and makes the patient pee all over everything. That's a little embarrassing for your patient. So make sure they empty their bladder first. If they need a urine sample for any reason, this is the time you're going to say, okay, I want you to go to the restroom. We're going to need a urine sample. Kind of get that done all in one swoop before they get started. And then again, you'll be able to help with measuring their height, their weight, taking their vital signs. And then again, you're going to help drape the person for the exam. Okay? Now, measure their height and weight before you ever get started. That's usually the first thing you do whenever you go to a doctor's office, right? And then if it's a new patient at a long-term care center or something like that, you're always going to weigh them when they first get admitted. And most of the time, you're going to see either a daily weight, a weekly weight, a monthly weight, something like that. There's going to be a certain time frame depending on like their diagnosis and different things as to how often you're going to weigh them. Now, sometimes we may have a standing scale like we have in there and practice on. Maybe there is a chair scale. Maybe your patient can walk, but they're so unsteady that they can't just stand on a scale. So maybe they're going to sit on a chair scale. There are such things as bed scales, especially in the hospital. You see them. That they come in there, they push a button, it takes your weight, period. And then you even have wheelchair scales, which you'll see a lot in long-term care. It has a little ramp on it that you push them up onto the scale. Most of the time, the wheelchair they are in has already been weighed, and they have that number written on the back of the wheelchair. So the wheelchair on the back of it might say 27.8. Okay, so we know whenever we get that patient's weight, we're going to subtract 27.8 from it, and that's going to tell us what the patient's weight is, not the weight plus the wheelchair. Okay, make sure you follow all the instructions. That's nothing new. We've had several questions where the answer is always going to be follow the manufacturer's instructions. Okay, now positioning and draping a patient, make sure before you help them assume and maintain a position. Again, you're going to explain to them why you're putting them in this position, how to get into that position, or how to assume the position. That makes me think of police. Assume the position. I don't know. How you're going to be draping them to try to keep them warm and for privacy reasons. And again, how long they would expect to stay in this position. Now, the positions that we're going to see the most often are dorsal recumbent, also sometimes called horizontal recumbent, lithotomy, knee chest, and Sims. Okay, now y'all learn, or should have learned probably, some of that may be an intro, I'm not sure, but those are actually some of our skills that we will do. We'll be going into positioning patients now. So as you assist with the exam, you may be asked to help prepare, position, and drape them. So again, you may have to assist whatever doctor or nurse that is doing the exam. Now, if you have a patient with dementia, which in long-term care is very probable, okay, they may fight you on this because it's very uncomfortable for them, and if they can't understand the instructions and why you're doing this, they almost feel like you're attacking them. Okay, and of course, anytime you're feeling attacked, your natural reaction is to fight back. So again, sometimes they might act very agitated, very aggressive with you because of their confusion and their fear. Now, if a person refuses, you cannot force them or restrain them to do it. Okay, if they are, especially if they are of sound mind and they don't want to do it, you can't really force them to do it. You can try to talk them into it. You can try to explain better, or there's a lot of methods we try to use to try to calm their fears. But sometimes it may just be, well, we're going to have to do it another time. This is not a good day for you. You're having a bad day, and maybe we'll try again tomorrow. Okay? Maybe we just need their daughter. Maybe if we get their daughter to come with them, their daughter can help calm them down. They're going to have someone there that's familiar, that's going to make them feel a little bit better to help them want to do it. And then sometimes the doctor may order different medications, something like Valium or Ativan, or something that's going to help relax the patient. But again, we always respect their rights. Now, after the exam is over, you may have to help that person get dressed again, maybe help them back to their bed or room. And again, if they're, especially we think about, these types of exams, we really think a lot too about, like women, we have to get like pap smears and stuff, so they use a lot of like KY jelly and goop to get the speculum in and do things, so you might have to clean them up afterwards, because that stuff is really slick, and so you may have to kind of clean them off after that is done. And then again, just make sure they're clean before you put their clothes on and help them back to their room. Now, you need to clean the room after you're finished. Again, most of the items are going to be disposable, so we're going to dispose of those properly. And again, following standard precautions and any blood-borne pathogens, because if there is any blood on anything, we're going to want to make sure that's in a biohazard bag. Make sure that you replace any items for the next exam. Kind of get the room set up for another time. Any kind of reusable items. You may need to sterilize or clean according to whatever policy there is there. And speculums, if they are, again, speculums we use that I normally see used are disposable, but if not, you're going to send them down for sterilization. And cover the exam with a new paper. I don't see draw sheets used a lot. Usually they have a little roll of paper that you just kind of pull it down, tear it off, and you got a brand new covering. Make sure that you clean and straighten the person's unit or exam room, and again, just follow any policies about soiled linens and things like that. Now, resident care is always given in a way to make sure that you're protecting your residents' dignity and their self-esteem. So make sure we're very respectful to them. And again, they should know the reasons for the exam. Why are you doing this, and what's going to happen during the exam? That's a big deal. And again, we only want minimal staff to be involved. It has to be involved because these physical exams are very invasive. So again, you have to have consent from your patient, and the doctor tells the family. And again, the person can share information with others if they want to. Again, we have to make sure we're protecting privacy. If the patient doesn't want their family members to know, we can't tell them. Okay? Any questions?